Hello, everyone. We're back. Sorry about that interruption, but when you do live sessions, it happens. But we were talking about different coping mechanisms to reintegrate ourselves into society after the pandemic and after everything that has happened. We also have on the screen a menteecom link that you can log on and ask Dr. Agapito questions while we're in the section of this presentation. So please log on if you're on and send us over your questions. Dr. Agapito, what are some of the signs and symptoms that parents or teachers can look out for um, when they're noticing changes in students?
So, like I was mentioning earlier, with every transition and every adjustment comes stress, and it's normal to experience stressful situations during change. But when it gets so severe, when the stress gets so bad that it's affecting academic, social, or occupational functioning, that's when it becomes a pathology, and that's what I was mentioning before the cutoff. Leading into your question, the symptoms and the signs that often lead to occupational, academic, or social dysfunction include changes in sleep, changes in appetite, poor academic performance, poor energy, just fatigue during the day. All of these signs, I believe, are things that teachers and staff can look for in students who they feel are experiencing a mental health crisis. So again, for someone who is concerned that a child or a student is experiencing high levels of stress and may need the attention of a mental health specialist, they're going to want to look to see if they're performing well academically. If they notice a decrease in grades, a decrease in academic performance, that's going to be very concerning. Fatigue during the day, poor concentration, getting in trouble more in school, and just basically not being able to sleep or eat. Th- these are um, these are signals that the student should probably seek counseling, or the teacher can talk to the student and say, hey, you know what's going on? Is everything okay?
Have programs or um, internship programs that expose different fields. They can get certification as a nurse's aide, and or for pharmacy, their pharmacy tech. Is there anything like that of psychiatry where a student may be able to do something prior um, to uh, the field that can give them experience?
Right. So the good thing is with high schoolers, I believe there's just been a surge of specialty high schools that focus on helping a student transition into the healthcare field. That may be a good start. They have specific programs in high school geared towards biology, towards mental health sciences. And then when you're in college, if you realize that you do want to get into mental health from college, there's a lot of different programs that allow you to get early admissions into medical school and allow you to transition to nursing programs. I know that nurses can become nurse practitioners, and from there they can specialize in the field of mental health and be able to prescribe medications. There's also a route that some people take that's shorter than medical school, where they become a physician assistant, and it costs a lot less money, a lot less time. You end up prescribing medications similar to what a psychiatrist does, except that you're under the supervision of a psychiatrist and you all work together as a team. So all of these different career paths are designed to do one thing. They're designed to meet the need for mental health services. And I think that, as a community, that's something that's lacking. And it's nice to hear when people aren't interested in mental health, because it's a specialty that is not going away. It's a specialty whose demand continues to increase every single year. where the stigma of mental illness is disappearing as we're learning more and more about the biological basis behind mental illness, and as the stigma decreases, more and more people are becoming interested in the field, and that's very great news for us because we are in dire need of mental health services, both from the therapy side and from the prescriber side.
And what are some of the resources that are available to everyone in the community watching that may have questions or that may want to look up more information regarding mental health?
So I know that DHR Health, we definitely have a lot of pamphlets with regards to the resources that we offer. Outpatient services, inpatient services. We have uh, intensive outpatient program that's very beneficial for those who don't meet inpatient criteria. In terms of wanting to learn the field in general, my advice to students is to seek out a mentor, like to seek out somebody in the mental health field that they can shadow, so that they can explore the day to day, the day to day events that occur in the life of a mental health specialist, and they can get early exposure to the patient population, and if this is something that they really want to go into. So my advice to students who are interested in mental health is to seek a mentor who will introduce them to the field, who will nurture their motivation and their interest, and if they are interested in actually receiving mental health services themselves, then DHR Health has a lot of information on their website. In our actual hospital, we carry pamphlets and booklets with regards to the services that we provide, and be able to transition them to getting the help that they need.
Also, another question, and I know that we had some of the questions from our students earlier, was what is the difference between psychiatry and psychology? Because I know that sometimes people get the terms mixed up, and they they believe psychologists are the same as psychiatrists. So can you kind of give us a little insight into that?
So the primary difference between a psychiatrist and a psychologist, other than the pathways to their training, is that a psychiatrist actually prescribes medications and is able to take into account the side effects of the medication and the medical comorbidities that are associated with a patient's mental illness. A psychologist helps out a psychiatrist significantly by doing confirmatory testing to confirm certain diagnoses, and they're able to do advanced forms of therapy. So they approach treating mental illness using psychological testing for diagnostic clarification, and through advanced psychotherapeutic techniques to help a patient non-pharmacologically. While a psychiatrist can also provide therapy because we're trained in it during residency, but mainly what we also do is we're able to offer pharmacological treatments as well as some procedural treatments like transcranial magnetic stimulation and ECT. So um, the in conclusion, the difference between a psychologist and a psychiatrist is what we have to offer in terms of how we treat the patient.
But the time that is spent getting the degree is similar.
Um, I can't speak for the psychologist per se, but I know that for psychiatry, it's 4 years of college, 4 years of medical school, 4 years of residency, and if you want to further specialize in child psychiatry, geriatric psychiatry, consultant liaisons, or forensic psychiatry, it can range anywhere from an additional 1 to 3 years. And again, I can't speak for the psychologists. I think that they would be more informed as to
Right.
their level of training and how long how long they are in school for. But the important thing that I want to get across is we're all one team. We play different roles, but at the end of the day, a psychologist, a psychiatrist, and a therapist are all equally effective at treating mental illness. We do it in different ways, and it's very important that all of us continue to work together to make sure that we maximize the effectiveness of treating our patients who have depression, anxiety, schizophrenia, or other mental illnesses.
Okay. I want to open it up to those of you that are watching us live and have you guys text in or go to our website or go to the Mentee site and write in your questions for Dr. Agapito. I know one of the questions that usually comes up is what you did in high school that helped you become more of a competitive candidate to get into college, and then also what you did in college to help you get into medical school. If you can kind of give us a little insight on that.
So, so in high school, I'll be honest, I didn't know specifically that I wanted to be a psychiatrist. I just knew that I was interested in medicine. And so I focused a lot of my efforts in making sure that my grades in biology, math, and the sciences were very high. But at the same time, we all know that school rankings can play a big part in what college you go to. So when you're in high school, the goal should be getting into a college that has a strong biology program, because having a strong biological basis can set you up for succeeding on your MCATs or your entrance exam, and increasing your chances of getting into medical school. So the goal for high school students right now is to get into to a college that has a very strong biology program, or a college that has an early admissions program. Even if they don't want to do medicine per se, they want to say, hey, you know what, I don't want to spend 4 years going to medical school or 4 years in residency. That's a lot of time. I just want to be a PA. I do want to prescribe medications. I want to take care of the community. Then they should still go to a college that has a strong biology program, because from there they can choose if they want to do nursing, if they want to do PA, if they want to, if they want to do medicine. If they tack on a psychology degree on top of a biology degree while they're in college, that may even make them more of a competitive candidate if they want to go into mental health, because they are exposed to the psychological basis behind mental illness, and and having a psychology background shows that interest. Um, in terms of high school right now, in addition to, of course, focusing on making sure you get the best grades possible, make sure that you're heavily involved in the community, volunteer work, volunteering at hospitals, showing that you're interested in medicine, showing that you're interested in mental health. If there's volunteer opportunities in mental health settings like inpatient facilities, and you're interested in mental health, take that opportunity. It looks good. It looks good applying to college, and it looks even better when you apply to medical school or nursing school or PA school. When you're in college, again, you choose a biology major if this is the path that you really want to go into. Maybe have a psychology background, and from there transition into to the type of professional school that you want to be at. But regardless, wanting to go into mental health doesn't mean you have to go to medical school. You can again, there's nurse practitioners, there's PAs, there's licensed professional counselors, and all of them are in demand right now. And it's very important to note that all of them are very critical to the treatment of our community.
Well, I know we have some questions that we are receiving. One of the questions that we have is, what exercises or techniques should a teacher mention to the students that maybe are nervous about returning to school?
In terms of exercises, I always recommend relaxation techniques to reduce anxiety. Things like deep breathing exercises, things that a lot of our therapists teach our patients to control their anxiety from a non-pharmacological standpoint. Physical exercise is actually very critical in helping with mental illness, because exercise produces endocannabinoids in the brain, which helps with mood stabilization and anxiety. So making sure that the patient or the student is physically active, having them engage in deep breathing exercises, can definitely help to mitigate some of the symptoms that are caused by extreme stress brought about by academic adjustments, or adjustments to their environment.
Okay, another one of the questions that we have is, what advice can you give someone who is maybe not ready to open up about getting information or help regarding mental health?
So usually for someone who is scared to open up about their mental health issues, I start off by educating them about the biological background of mental illness. I try to tell them about the science behind developing psychiatric illness. And here's why. I feel that there was a stigma that's improving against mental illness, but I noticed that when people get diabetes, they don't they're open to telling people that they have diabetes. If they have a flu, they're open to telling their teachers, "Hey, I was sick with the flu." What needs to happen is mental illness needs to be put on the same playing field as other medical illnesses, and that's what I try to do when I explain to someone who's scared about opening up about their mental health. I tell them, "Hey, right now, what I want you to do is I want you to think of your mental illness as a chemical imbalance in the brain that needs to be fixed, similar to high blood sugar being treated in diabetes with insulin. I need you to start treating your mental illness as if it's equivalent to cancer, because if cancer goes unchecked, you die. If mental illness goes unchecked, you can develop suicidal thoughts and hurt yourself." So I try to explain to them that there's a lot of research behind the chemical imbalance involved in depression and anxiety. And once I'm able to explain the neuroscience behind psychiatric illness, they're more likely to open up about their mental illness, because they say, "Hey, you know what? This isn't my fault. It's a chemical imbalance in my head that's causing me to have sleeping difficulties, appetite changes, poor energy, poor concentration." And now they're more open to talking about it. They're more open about talking about their symptoms. And once I tell them, in addition to that, a lot of the social stressors can be traumatizing for the brain, which in turn worsens that chemical imbalance, they're more accepting of the fact that, hey, this is nothing to be ashamed of. This is an illness. This is similar to me getting high blood pressure. I need to take my medications for my blood pressure or my diabetes.
Thank you. I know we have a couple more minutes, and we got some more questions coming in. One of the questions is, can you get counseling without doctor's referral?
And at DHR Health, I believe you can. And I think that it's important to even get a counseling referral before a doctor's referral, because again, the difference between a psychiatrist and a counselor is the way we approach treating patients. The counselors use non-pharmacological means, such as helping the patient develop coping skills, while I use medications. We all know that medications have risks, benefits, and side effects. So what I usually tell my patients is, if the symptoms that they're experiencing are due to an adjustment, transitioning back to school, family stressors at home, it's more agreeable for them to seek counseling services first, then escalate their care to me if they're not able to cope with their stress, or their symptoms continue to occur even after talking with the therapist and going over coping skills. So I always tell my patients, counseling first, medication second, and both of those are always better than either one alone. So I'm a very big proponent on making sure that the patient always has psychotherapy services prior to or during treatment with the medications that I prescribe.
One more question here. How does forensic psychiatry work?
So forensic psychiatry is actually different from clinical psychiatry in that their main job is to determine competency to appear in court. So they work mainly with the legal system. We all know that because in the inpatient setting, we often hospitalize patients involuntarily. There's an overlap between, the legalities of being able to keep someone and treating them. So there is overlap between the legal system and psychiatry, but forensic psychiatry in particular is more involved on the legal side. So they work at jail centers. They work at jail centers to make sure that the patient is competent to testify in trial. They don't do a lot of medication management from what I saw during my rotation in residency, but they do a lot of testifying in court about the competency of a patient, or a patient who has committed a crime, and they're trying to justify whether that crime was in the context of their mental illness.
So another question I want to ask is regarding just financial literacy, or finances in general. Going to medical school, going to college, and seeking higher ed degrees is costly. In your path, were you able to work while going to school, or did you go to school full time, or what was your experience?
So in college, I was actually part of a work study program which helped offset some of my tuition costs. In medical school, my advice to anybody who goes to medical school and gets in is to not work. And here's why. Medical school is a different it's a different environment from college. It's just so academically intense. It requires so much of your time and so much of your mental capabilities that it's that you're really not going to perform optimally if you're working while going to medical school. So I always advise students to put 110%. If they decide to go to medical school, I advise them to put 110% into medical school. It's okay to work during college. That's fine. It can offset some of the costs. Some of the classes that you're taking, depending on the semester, may be easy if you're a biology major, and a lot of your art related classes are a little bit easier. You can afford to get a job. But in medical school, this is what you want to do for the rest of your life. And I wouldn't want anybody to sell themselves short by, you know, making only half the effort because they had to spend their other time working while they were putting themselves through medical school. Now, you mentioned that medical school is expensive. You are correct. My recommendation is, if you're able to get into medical school and you get approved for those loans, just take the loans. I guarantee you that later on, once you're done with residency, there are programs out there in the community that will help you pay back your student loans, even if it seems astronomical. I'm part of a loan repayment program right now, so I'm still paying off my student loans, but I wouldn't have it any other way. I would recommend never letting the cost of medical school stop you from applying to medical school. Never let the cost of education stop you from getting a higher education. It is always worth it. Yes, it shows up on your credit score and you're like kind of weirded out about it, but it doesn't impact you as much as all the other stuff. So, and everybody knows that. That's good debt. You're investing in yourself. So it's very important to not focus so much on the costs as much as what do I need to do to get to where I need to be? What do I have to do to get my dream job? If it means taking out loans to pay for higher education, then so be it.
Well, Dr. Agapito, we've talked about quite a bit of different topics today. Is there anything that you would like the community to know, or anything that you would like to close this segment with regarding just mental health in general, and the role that you play, and the hospital, as well as everybody on the team, plays in making sure that we're all mentally healthy?
So if I had to say a summarizing statement based on everything we talked about, it's know how to recognize mental illness, take mental illness seriously, and know that there's resources in the community that can address mental health related concerns. Outpatient, intensive outpatient, inpatient, DHR Health has all of these services. If you or your loved one feels like you're experiencing such levels of stress that it's interfering with your occupational, social, or academic functions, please seek help. If mental illness continues to go unchecked, it will lead to acute safety concerns and significant trauma moving forward. For those who are interested in mental health, um, basically just summarizing everything I said, it doesn't have to be medical school. We need therapists, we need psychologists, we need nurses, we need everybody who's critical in the mental health field, and we're all one big team. Mental health demand is surging, and we welcome anybody who's interested in the specialty and interested in the field, and you would be doing the community a very, very great service.
Dr. Agapito, thank you so much for joining us today and being our keynote speaker. And to all the viewers out there, to the students, parents, administrators, and our community, again, just echoing what Dr. Agapito was saying regarding mental health. We want to ensure that there isn't a stigma, and that's why we have conferences such as these, and we have different techniques to deal with. And one of the things that I just want to let everyone know is that partnering with local hospitals, partnering with different doctors throughout the region really helps us as a service center get the information out to you. So if you ever have any questions, concerns, or comments, please know that you're welcome to on our website and let us know any of your concerns and comments. Dr. Agapito, thank you so much for your time today, and thank you to DHR Health for helping us secure you as our keynote speaker.
Thank you so much for having me.
Thank you.